Just one crushed clove of garlic a day may help prevent heart attacks, cleanse your arteries, and protect your heart more effectively than any pill you've ever taken. So why aren't more people doing it? Every year, more than 275,000 women in the United States die from heart disease, and that number continues to rise after age 60. Could something as small and common as a garlic clove, found in nearly every kitchen, really stand up to the #1 cause of death in women? What actually happens in your body when you eat raw garlic every day? Why does it need to be crushed? How long does it take to work? And can garlic truly help prevent a heart attack, as some research now suggests? If you're 60 or older and concerned about your heart health, this is a video you can't afford to ignore, because the small decisions you make today may determine whether you're still here with your family next year. Heart disease and stroke are not just medical terms. They are the real reasons millions of older women lose their independence, their memory, their health, and their connection with their grandchildren. The most dangerous part isn't the heart attack itself, it's the false sense of security that everything feels fine until it's too late. Many women over 60 don't show typical symptoms: no chest pain, no shortness of breath, no dizziness. But inside, the artery walls are thickening, cholesterol is building up, and blood flow is slowing with age. Garlic is not a miracle drug, but when used properly, it may help relax blood vessels, lower blood pressure, fight inflammation, and protect the endothelium, the first line of defense against plaque buildup and heart attacks. In this video, you'll learn exactly why one crushed garlic clove a day could make a meaningful difference for your heart health, especially after 60. Keep watching, because what you're about to learn may forever change the way you take care of your heart. Garlic is one of the oldest foods used in traditional medicine, but only in recent decades has modern science clearly confirmed its true biological effects, especially on the cardiovascular system. When you crush a raw garlic clove, a chemical reaction occurs. The compound olein in garlic is converted into allicin, the key active component responsible for its powerful heart protective benefits. Allicin doesn't naturally exist in an intact garlic clove. It only forms when garlic is crushed or finely chopped and exposed to air for about 10 minutes. This sulfur-rich compound helps relax blood vessels by stimulating the production of nitric oxide in the endothelium. Nitric oxide is a signaling molecule that allows arteries to dilate, which reduces blood pressure and improves circulation. For women over 60 whose natural ability to regulate blood pressure declines with age, this kind of vascular support from natural sources like garlic is especially important. Beyond lowering blood pressure, allicin also helps prevent platelet aggregation. Platelets are tiny cell fragments that play a role in clot formation. Under normal conditions, they prevent excessive bleeding, but when they clump abnormally along a damaged vessel wall, they can form dangerous clots, blocking blood flow and triggering a heart attack or stroke. Garlic helps reduce platelet stickiness, providing a natural and safe way to lower the risk of intravascular clots. Garlic also plays a role in regulating blood lipids. Studies suggest that regular consumption of raw garlic may lower LDL cholesterol, the bad type, and triglycerides, while raising HDL cholesterol, the good type. Elevated LDL is one of the leading causes of atherosclerotic plaque buildup, a major risk factor for heart attacks and strokes. As these plaques accumulate, arteries narrow, blood flow decreases, and the chance of rupture and clot formation rises. Garlic helps slow this process by lowering harmful fats and reducing inflammation in the endothelium. In addition, allicin has strong antioxidant properties. Oxidative stress occurs when there is an excess of free radicals in the bloodstream. These free radicals attack cell membranes, DNA, and other vital molecules, damaging the blood vessel walls and triggering inflammatory responses. In women over 60, as the body's natural antioxidant defenses decline, factors like high blood pressure, elevated blood sugar, or abdominal fat further increase the risk of endothelial damage. Garlic provides an added layer of protection, helping to reduce oxidative stress and shield the vascular lining from harm. Some evidence also suggests that garlic can improve endothelial function, the layer of cells lining the inside of blood vessels, which is essential for maintaining the flexibility and responsiveness of arteries. When the endothelium becomes inflamed or damaged, the risk of plaque formation increases significantly. Garlic supports the repair and recovery of this lining by enhancing the production of natural anti-inflammatory and mild anticoagulant enzymes. But garlic's benefits don't stop with isolated effects. It creates a positive synergistic impact across the entire cardiovascular system. When blood pressure is stable, arteries remain open, cholesterol is under control, and inflammation is reduced, the heart can function more efficiently and with less strain. This is the foundation for preventing early complications such as heart failure, arrhythmias, or chronic angina, conditions commonly seen in older women. All of these benefits can only be fully realized when garlic is used correctly, at the right dosage, and on a regular basis. Understanding garlic's biological mechanisms not only builds your confidence in its value, but also empowers you to use it as a practical part of long-term heart attack prevention. Specific effects on the heart and arteries in women over 60. After the age of 60, women begin to experience deep physiological changes, not only in hormones, but also in the structure of the cardiovascular system. When estrogen levels drop after menopause, the body loses a natural layer of protection against atherosclerosis and endothelial inflammation. Estrogen once played a vital role in keeping blood vessels flexible and resilient, preventing the buildup of bad cholesterol in the arterial walls and supporting healthy blood flow. As this hormone declines, the aging process of blood vessels accelerates, increasing the risk of high blood pressure, hardened arteries, plaque formation, and arrhythmias. This is one reason why heart disease mortality in women over 60 rises sharply, often surpassing that of men in the same age group. Garlic, especially when raw and properly crushed, may help interrupt many of these disease-causing mechanisms. The first major benefit lies in blood pressure regulation. Garlic helps lower blood pressure by relaxing blood vessels, reducing vascular resistance, and improving blood circulation. In older women, blood pressure often rises silently, putting extra strain on the artery walls, damaging the endothelium, and speeding up plaque buildup. A study in postmenopausal women found that regular use of raw garlic helped reduce systolic blood pressure by an average of 8 to 10 mmHg over 3 months, comparable to the effect of mild antihypertensive medication but without the serious side effects. Beyond blood pressure control, garlic also helps improve arterial elasticity. When arteries lose flexibility, the heart must pump harder to circulate blood, which over time can lead to heart failure. Allicin, the active compound in garlic, helps restore endothelial function, allowing blood vessels to maintain their ability to contract and relax. This is especially important for women over 60, whose vascular systems lose self-repair capacity as part of the aging process. Another major benefit of garlic is its ability to slow the progression of plaque buildup in the arteries. In older adults, especially women with a history of diabetes, high cholesterol, or abdominal obesity, the blood vessel walls are more prone to accumulating LDL cholesterol and triglycerides. Garlic helps reduce LDL levels in the blood while increasing HDL, which assists in cleaning the arterial walls from the inside. When used consistently, garlic helps prevent inflammation and fat oxidation, two key processes that make plaques dangerous. This can significantly reduce the risk of plaque rupture and artery blockage, which are leading causes of heart attacks. Garlic also supports heart function by helping to stabilize heart rhythm, reduce vascular spasms, and increase oxygen delivery to the heart muscle. A healthy heart needs steady, uninterrupted blood flow, free from clots or atherosclerotic blockages. By promoting mild blood thinning and preventing abnormal platelet aggregation, garlic helps the heart beat more regularly, reduces strain on the heart chambers, and lowers the risk of myocardial ischemia. For women over 60, this can be an effective way to prevent heart failure and heart attacks. In addition, garlic improves peripheral circulation. Many older women experience cold hands and feet, leg cramps, or nighttime discomfort due to poor blood flow. Garlic stimulates circulation throughout the body, helping reduce cold sensations, improve tissue nourishment, and support recovery from injuries or chronic health conditions. Lastly, an often overlooked but critical benefit is garlic's ability to protect heart cells from oxidative stress. As we age, heart cells become more vulnerable to damage from free radicals generated by metabolism and chronic inflammation. Allicin and other antioxidant compounds in garlic help neutralize these free radicals, preventing cell death and preserving cardiac strength. All of these cardiovascular effects are particularly meaningful for women over 60, a time when heart disease risks rise sharply but often go unnoticed. Adding 1 crushed clove of raw garlic to your daily routine isn't just a simple choice, it's a proactive step toward comprehensive heart protection. It helps preserve your health, your independence, and your quality of life well into your golden years. To fully understand how 1 crushed clove of garlic each day can help prevent heart attacks, we need to take a closer look at how these two life-threatening events actually develop. Both heart attacks and ischemic strokes begin with the same root cause: damage to the blood vessels and the formation of blood clots. When the artery walls are chronically inflamed, oxidized LDL cholesterol gradually builds up and forms plaques. Over time, these plaques thicken, narrowing the arteries and reducing blood flow. In some cases, a plaque ruptures, and the body reacts by clumping platelets together to seal the damage, resulting in a blood clot. If that clot completely blocks blood flow to the heart, a heart attack occurs. What's alarming is that this process can unfold silently over many years without any noticeable symptoms. In women over 60, heart attack symptoms are often atypical. Many don't experience chest pain but may feel only fatigue, mild nausea, or a dull ache in the back. Because of this vague presentation, most women fail to recognize the signs early and miss the chance to take preventive action. Garlic intervenes at several key stages of this dangerous process to help disrupt the deadly cycle. First, garlic helps protect blood vessels from damage by reducing inflammation and oxidative stress. The endothelium, the inner lining of blood vessels, is highly sensitive to factors such as high blood pressure, elevated blood sugar, high cholesterol, and oxidative stress. Allicin and other compounds in garlic help calm low-grade chronic inflammation in the arteries, preventing it from spreading and keeping the vessel walls soft and flexible. This helps stop the very first step in plaque formation and lowers the risk of arterial blockage. Second, garlic helps lower LDL cholesterol levels and prevents it from becoming oxidized. The oxidation of LDL is a critical trigger in the development of plaque. When LDL is altered by free radicals, it's more likely to be engulfed by macrophages within the artery walls, forming thick, hardened deposits. Garlic not only reduces the overall amount of LDL cholesterol in the blood, but also enhances the body's own antioxidant enzymes, which help neutralize free radical damage before it begins. Third, garlic helps maintain healthy blood flow by reducing platelet stickiness. Platelets are a normal part of the blood clotting process, but when they become overactive, they can pose serious risks. Garlic helps lower the tendency of platelets to clump together without dangerously thinning the blood like some medications do. This allows it to naturally help prevent clots from forming inside blood vessels while still preserving the body's normal clotting function. Fourth, garlic gently and steadily helps lower blood pressure. High blood pressure is the single greatest risk factor for both heart attacks and strokes. When pressure inside the arteries rises, the vessel walls become stretched and more prone to rupture, creating the ideal conditions for platelets to trigger clot formation. Several studies have shown that eating raw garlic daily can lower systolic blood pressure by 5 to 10 millimeters of mercury in people with mild to moderate hypertension. For older women, even a small drop like this can make a meaningful clinical difference. One important point is that garlic can be safely combined with modern medical treatments, such as antihypertensive drugs, statins, or aspirin, provided it's done under the guidance of a healthcare provider. That means you don't need to stop your medications. You simply add garlic as a long-term support tool. It's the combination of medical therapy, natural nutritional support, and consistent lifestyle changes that leads to the most significant reductions in first-time or recurrent heart attacks in women over 60. Once you understand what's really happening inside your body and how garlic works at each stage of cardiovascular disease, you'll realize that crushing just one clove of garlic a day is a small habit that can help prevent some of the most serious medical emergencies that not everyone is lucky enough to survive. How to use garlic correctly each day. Understanding the benefits of garlic is one thing, but to truly experience its effects, you need to know how to use it properly, safely, consistently, and in the right amount. This is especially important for women over 60, as digestive function, metabolic enzymes, and underlying health conditions can all affect how well the body absorbs the active compounds in garlic. Using it the wrong way may not only reduce its benefits, but also lead to digestive discomfort or unwanted side effects. First, to activate allicin, the compound responsible for most of garlic's cardiovascular benefits, the garlic clove must be crushed or finely chopped. When garlic is cut or mashed, the enzyme alliinase is triggered, converting olein into allicin. But this conversion doesn't happen instantly. After crushing garlic, it's important to let it sit for at least 8 to 10 minutes to allow the allicin to fully develop. If you swallow it right away, the enzyme doesn't have enough time to react and much of the benefit is lost. Garlic should be consumed raw because high heat destroys allicin. Cooking garlic in oil or boiling it can eliminate up to 90% of its active compounds. If you can't tolerate eating it raw, add it to your food only after cooking is finished. A simple method is to crush the garlic, let it rest for 10 minutes, then mix it with honey, olive oil, or spread it on cool bread. The recommended dose is 1 medium-sized clove per day, about 1 gram. Avoid consuming large amounts at once, as garlic may irritate the stomach lining, causing heartburn, bloating, or diarrhea. For women over 60 with a history of ulcers or acid reflux, garlic should be taken after a full meal, not on an empty stomach. If you experience discomfort, try drinking warm water after eating garlic to reduce odor and help digestion. The best time to take garlic is in the morning after breakfast or about an hour before bedtime, if you've had a light evening meal. Daily use is key to long-term effectiveness. Some people believe that eating garlic a few times a week is enough, but in reality, the body needs a steady supply of allicin every day to maintain its blood pressure lowering, anti-clotting, and anti-inflammatory effects. Other ways to use garlic safely and effectively. Besides eating it raw, there are other practical ways to incorporate garlic into your routine, such as infusing it with honey or apple cider vinegar. Garlic soaked in honey is not only easier to consume, but also supports the immune system, making it especially useful for older adults during the colder months. However, you still need to crush the garlic and let it rest before mixing it with honey to ensure that allicin is fully activated. Avoid relying on dried garlic capsules unless they are backed by clear scientific testing, since the manufacturing process can destroy the key compound, especially allicin. It's also important to understand that garlic can interact with certain medications, especially blood thinners like warfarin or aspirin. If you're currently taking anticoagulant medications, talk to your doctor before adding garlic to your daily routine. Combining the two may increase the risk of bleeding. Additionally, if you're scheduled for surgery, you should stop using garlic at least 1 week before the procedure to avoid interference with clotting. For people with digestive issues such as gastritis, colitis, or irritable bowel syndrome, raw garlic should be introduced with caution. Start with a low dose, such as half a clove per day, and increase slowly as your body adjusts. Drinking plenty of water and pairing garlic with gentle, fiber-rich foods like oatmeal, bananas, or boiled potatoes can help reduce burning or bloating. Garlic is not a drug and should not replace medical treatment in serious health conditions. But when used properly, it can become an important part of a proactive, preventative lifestyle, especially for women over 60 when the cardiovascular system begins to weaken, and the body needs extra natural support that is safe, accessible, and easy to maintain at home. In addition to its primary role in supporting cardiovascular health, garlic offers a range of secondary benefits that can significantly improve the overall well-being of women over 60. While these effects may not be the main reason to use garlic, they play a valuable role in enhancing daily quality of life, promoting physical resilience, lowering the risk of additional health conditions, and supporting healthy aging. First, garlic is a powerful natural immune booster. Its high content of sulfur compounds and antioxidants helps the body fight off bacteria, viruses, and fungi more effectively. This is especially important for older adults whose immune systems naturally decline with age, making them more susceptible to respiratory infections, seasonal flu, or other illnesses. One study involving older individuals who consumed garlic daily found that the number of sick days from the common cold dropped by nearly 60%, and recovery time was also faster compared to those who didn't use garlic. Garlic also supports digestive health in a natural way. It has mild antibacterial properties in the gut that help control harmful bacteria without disrupting the balance of beneficial gut flora. At the same time, garlic stimulates the production of digestive enzymes, which improves nutrient absorption and helps reduce common issues like bloating and indigestion, especially prevalent among women after age 60. Better digestion means the body can more effectively absorb essential vitamins and minerals from food, which supports cell regeneration, reduces fatigue, and improves skin and hair health. Additionally, garlic plays a role in supporting blood sugar control. Several studies have shown that garlic can enhance insulin sensitivity and lower fasting blood glucose levels in people with prediabetes or type 2 diabetes. For older women at risk of metabolic disorders, maintaining stable blood sugar is critical to preventing complications in both small and large blood vessels, including those affecting the heart. When garlic is used alongside a low-sugar diet and regular physical activity, it may help stabilize glucose levels without the need for early increases in medication doses. Garlic can also contribute to gentle weight management. While it's not a specialized weight loss food, its ability to support metabolism, increase energy expenditure, and reduce appetite can aid in maintaining a healthy weight. This becomes especially important for women over 60, as visceral fat tends to accumulate more rapidly during this stage of life, placing extra stress on the heart and raising the risk of coronary artery disease. When used consistently as part of a balanced diet, many women notice a firmer waistline and reduced abdominal fat over time. Another noteworthy benefit is garlic's potential to support memory. Preliminary studies in animals have suggested that allicin and other antioxidant compounds in garlic may help prevent the formation of amyloid plaques in the brain, one of the hallmarks of memory loss. For older women, keeping the mind sharp, maintaining quick reflexes, and preserving memory are key to staying independent and enjoying a higher quality of life. Garlic also offers mild relief from joint pain thanks to its natural anti-inflammatory effects. Allicin has been shown to inhibit certain enzymes involved in the inflammatory response, which may help reduce mild joint swelling and stiffness, particularly in the morning. While garlic is not a replacement for arthritis medication, many individuals report improved mobility and less discomfort in daily activities when it's incorporated into their routine. These secondary benefits, though not the primary reason for using garlic, contribute to overall health and resilience. They help women over 60 maintain flexibility, mental clarity, and the ability to care for themselves independently. Adding one crushed clove of garlic to your daily routine isn't just about protecting your heart. It's a long-term investment in a healthier, more independent, and more fulfilling aging experience. At 66 years old, Mrs. Dorothy from Oregon experienced a hypertensive crisis with chest pain after pushing herself during a brisk walk. Tests revealed she had moderate atherosclerosis and was at high risk for future cardiovascular events if she didn't change her lifestyle. After being discharged, along with her prescribed medications, she was advised to adopt a heart-healthy diet and explore natural support options. One day, she came across a video discussing the benefits of raw garlic and decided to give it a try. Each morning, Dorothy crushed a clove of garlic, let it sit for 10 minutes, then ate it with a small spoonful of honey. Though she wasn't used to the strong flavor or burning sensation at first, she stayed consistent for 3 months. The results surprised even her doctor. Her blood pressure became more stable, her cholesterol levels dropped slightly, and she no longer experienced the sharp chest pains she once had. Most importantly, her spirit lifted, because she felt empowered, actively taking charge of her health with a simple, natural habit. This story is not about miracles. It's proof of what the right knowledge, steady commitment, and intentional small changes can do. After 60, every act of self-care can make a big difference for your heart, your brain, and the quality of your everyday life. Just one crushed clove of garlic a day, when used correctly and consistently, can make a real difference in preventing heart attacks, improving circulation, regulating blood pressure, and supporting overall health for women over 60. This isn't some new trend. It's traditional wisdom now backed by modern medical research and real data. At an age when the heart becomes more vulnerable than ever, every small daily choice can have life or death consequences. Garlic is not a replacement for medication, but it is a simple, affordable, and powerful support tool. Whether you're currently healthy or already taking heart medications, this small habit can help extend your years of healthy, independent, high-quality living. Don't wait until your doctor gives you a warning. Don't wait until your body sends an emergency signal. Start today. A single step could shift the entire trajectory of your heart health for years to come. If you found this video helpful, follow the channel for more science-based information and medical warnings tailored specifically for women over 60. Hit the notification bell so you never miss out on critical updates. And share this video with your mother, sister, friends, or any woman entering her golden years who may not yet know how to care for her heart the right way. Because health won't wait, and what you choose to do today could determine whether you're still healthy and with your family this time next year.